Hello, everyone. My name is Stephanie Martinez. I'll be going over some information regarding cleft lip and palate reconstruction and repair. Um, this is some really good information. I did attach a PowerPoint for anyone who wants to follow along or view that. You can do so. Uh, it's really cool. I like it. It's my first PowerPoint ever. Um, this is to give you pertinent information regarding cleft lip and palate reconstruction and repair. There are many benefits to this regarding nutrition from feeding, middle ear health, speech delay and development can also be involved. Um, for the repair, there is a surgical intervention for the cleft lip and palate, and it is to repair the soft palate. Given there may be some problems with speech sounding nasal, from not being able to properly close from the mouth, from the mouth to the nose, and while speaking, letting air escaping through the nose, so it sounds pretty nasally. The lip is more associated with cosmetic rather than the need, but it can help with mother-infant bonding. Um, and cleft lip does help with assisting with functions of some speech and feeding, but mostly associated with cosmetic. Um, Difficulties feeding could be anywhere from it has been recognized with infants with cleft lip and or palate, or both combined, were unable to adequately suck and had failure to thrive. So repair is and reconstruction of the of the lip can definitely help with that. The oral palate or gum bridging devices have been used to reduce these difficulties, and also some feeding therapies are combined with this device. Feeding therapies would include um, holding the baby at an upright position and feeding that way, so there's no backflow into the nasal passages from the opening of the soft palate. Um, let's see. Um, Having their left cleft lip and soft palate repaired can definitely help with the weight gain success rate of weight gain, and thriving after surgical repair. It reduces regurgitation through basal cavity, and increased food intake were benefits from the surgical repair. Speech development. As we mentioned before, speech therapy was a common part of this um, treatment plan before and after repair. Children usually are saying their first words between the age of 6 and 12 months, such as mama, dada, baba, meaning bottle, or just learning their first words. It can be difficult. Surgical repair and reconstruction can take place anywhere between 6 months and 12 months, and a second, if need be, a second repair and reconstruction can also happen anywhere from 12 to 18 months. Um, Sounds and pronunciation are taught as part of this therapy plan to correctly learn to use his or her tongue. As you can see through some of the reconstruction video PowerPoint, that there was an opening there. Obviously, the tongue will, not have that opening there, so it would make the sound nasally. Pronunciations of the tongue from the lip having a cleft can definitely be associated with this, and so having speech therapy is pretty significant for that reason. Um, Also, hearing loss is another big deal that I'd like to really be involved in, and well, in total, all of it would be very interesting to me. Um, the craniofacial team is also works in conjunction with the ear, nose, and throat team, and what they do is they come in, since there's a lot of backflow from the secretions of saliva and or food, whether it be bottle feeding, breastfeeding, breast milk or formula, or even just baby foods. It just creates a lot of saliva and secretions to have backflow into the through the eustachian tubes into the middle ears. It definitely helps that. It definitely brings down the the part where people are um, close that area, so that way there's not as much diseases or infections that can get trapped in that area. The tubes are placed so that way that drainage has somewhere to escape. Also, the tubes act like a small drainage hole, so that there's that fluid doesn't just linger in the middle ear. It can also cause some hearing loss with that fluid being there. And then over time, if it stays lingering around, it can definitely cause the eardrum and those structures to break down, causing permanent damage to the hearing at that point. So I definitely love that part of the craniofacial team and kind of moving forward into that area, because it just definitely seems like it's an extension of what I do now, and very interesting, and definitely love helping our little humans with that, measures of healthcare. Um, I have given you some strong points in this area of medicine. How important it is to a child or infant born with this condition or related anomalies. Uh, anomalies. I have given great details through my research. I want to learn hands-on, and hopefully this PowerPoint and video gave you some good information on that. Um, Thank you, and God bless.